Hello, my name is Dr. Neil Baum. I'm a practicing urologist in New Orleans, Louisiana. And I would like to take this opportunity to show you a video on how to effectively empty the bladder in men using a one-time use sterile intermittent catheterization. In this video, I will discuss the purpose of intermittent catheterization, how to do it using a Lofric catheter, and what are the risks and complications of the technique. So what's the purpose of intermittent catheterization? Intermittent catheterization is used in men who are unable to empty their bladder. They may have obstruction to the ability to empty their bladder, such as an enlarged prostate. They may have an opening that does not relax, and it may be a temporary situation, such as after surgery, in order to avoid the use of a catheter that remains in place all the time, which is associated with more risks and complications than using the intermittent catheterization process. Intermittent catheterization is a simple procedure. It can be done by almost anyone who has the use of their hands. It may become a temporary or part of your regular routine. So what will you need to perform intermittent catheterization? I recommend you use a catheter designed especially for men that allows a one-time use, that is lubricated to allow easy insertion, and that contains a water-soluble lubricant. You also need soap and water to clean the penis, and you need a toilet or a collecting container to collect the urine that comes out of the bladder. So how to get started? Begin by washing your hands, washing the penis and skin with warm soapy water. Get in a comfortable position, and I recommend the use of a Lofric catheter. This is the Lofric catheter, and this is how I recommend that you use it. You pull open the tab, and then you can activate the solution by squeezing the tab, and you'll hear a pop, and the fluid will now go into the catheter. And then you remove the catheter very easily. Remove the catheter. And you will notice that the catheter has a ridge on the top, and that should be pointing towards the man's nose. The catheter is then easily inserted into the penis and then stop when urine starts to come out. It'll go in very, very easily because of its lubrication. When the urine stops draining from the bladder, this is the end of the tube in the bladder. When the urine stops draining from the bladder, then all the man has to do is to remove the tube and throw it away into a waste container. You should know that there are some risk and complication, and you should contact your physician if little or no urine comes out, if the urine is bloody or blood tinged, if the urine is foul smelling, which may indicate an infection, if there is pain or discomfort upon insertion of the catheter, or if the man experiences back pain or fever, which again are symptoms of a urinary tract infection. So in summary, intermittent catheterization is an effective method of either temporarily or permanently to use to empty the bladder. It is easily accomplished by most men. There are few complications associated with the technique, and it is far better than a permanent catheter with the accompanying leg bag. I highly recommend the one-time use Lofric catheter. If you have any questions, please let me hear from you. You can reach me at nbaum@neilbaum.com or via my website, www.neilbaum.com. Thank you.